Moving yourself or someone else from the home into assisted living facility can be confusing, and also there might be a lot of misconception about that. Thankfully, today I have Paul still here with me to help us out on this. Okay, so Paul, can you help me clarify a little bit about assisted living facility? There's
Mhm.
many type of that, or it just one?
No, there's definitely many types. So assisted living is more like the umbrella term for either people consider more like a large facility, like a 100, 150 bed facility, like the big ones you see out there.
Uh-huh.
And then we have the smaller ones that are like more, we call them a 6-bed facility. And the 6-bed facility is more a residential home that is licensed from the state. And you have 6 people live at each home, and we have 3 caregivers or 2 caregivers on staff 24/7 all the time. The larger ones are more, they're based on mild retirement, more like, hey, dinner's at 5 o'clock, come on down. We have bingo at 3 o'clock and so forth. Our kind of homes, the assisted living homes we have, are more geared around more hands-on help, a lot more help towards mom and dad. A lot of the misconception I see with people is they look at assisted living and they're not quite sure where mom should or dad should go when they actually leave their home they've been in for 30 or 40 years. It really depends on the level they're at currently at that moment. They are stepping stones. It's not like you go to one place and that's it for the most part. A lot of facilities will say that they're like that, but the reality is they're not really like that.
So you would say like if they're still more active,
Mhm.
need like more like socialized activities, so that would probably be the bigger one that
Correct.
have the games or functions available for them.
Correct, yes.
Okay, so if in such a situation where someone come to you and say, hey, I'm thinking about bringing my mom here, how do you help them? I mean, do you help them do some evaluations?
I do.
You looking at their medical record, or what do you do?
So I like to sit down and talk to families and really give them an honest opinion on what I think is best for mom or dad. So I'm here only for mom and dad. So if somebody comes to me, I'm not a sales guy, I'll talk to them about what I think is best for their mom and dad. If mom and dad are both together still and they want to just have some retirement, I kind of suggest a larger facility in the area. And then later on when they need more hands-on help, they can transition over into one of our facilities at that point.
Okay.
Yeah.
Is that because of like at the larger facility, you can have a bigger unit that they can stay together?
Yeah, they have like a small apartments. I mean, we have like private bedrooms. We have couples that share bedrooms and so forth. But yeah, it's more like when they're more mobile, they don't need as much people watching over them as much. More hands-on help with medication management and so forth. All the large facilities still do that for sure, but their core model, I'd say, is really more alert and active people. The large facilities do have like the memory care parts of their units that people go there, but most of my clientele, they come to me when mom and dad are either transitioning into the memory care facilities or they're at that point where they're about to go there. And mostly, to be honest, it's just a numbers game. The larger facilities more have like a 12-to-1 ratio with staff to residents, or have a 3-to-1 ratio.
Oh, that's a good point.
Yeah.
So you because it's more like, let's say, cognitive impairment, so you kind of have to watch them. That's why you have a lower.
Correct.
Okay.
Yeah.
How do you talk a little bit about how you staff people? What are the qualification? How do they come to
Yeah. So all the assisted living, we're considered non-medical facilities, which is great. So that means I take all directions and orders from physicians, from physical therapists, from nurses and that. So when people come into my home, they say they might have a private room they live at. So if I want to make med changes or anything, I'm always in constant communication with the doctors and the nurses to get directions from them. We're not the ones that make the decisions on what's best for mom and dad, but we are more based on they live at our facility with help all the time. So my caregivers are all, a lot of people I know, they don't hire like nurses and so forth, like in the board and care homes, just in the fact that they want to get more direction based on the doctor's advice and nurse's advice from their primary care physician or whoever's managing their care at that point. Majority of the staff in the board and care industry are live-in caregivers. That means they actually live on site. So if you're working, say, a 5-day shift, you actually live on site 24 hours a day for 5 days. You're living on site.
Yeah. What kind of training did they go through? I mean, if they are not registered nurse, but they have to go through specific type of training.
Right. So right now there's a 40-hour requirement for the caregivers to before they start working on the job. Yeah.
Okay. And you said that they take specific direction from the primary doctor?
They do.
Oh.
Everything we do is. So if if a resident's behavior is acting erratic for a few days different, I get in touch with the physician, talk to them about the changes I've witnessed, and we try to make either medication changes or if it's physical changes and so forth. So we get all directions from professionals.
Do they have to be a situation where you have to transport them to that doctor also, or you call the family member pretty much?
Both. So if somebody's going to go to the doctor, the families always are aware of they're going to the doctor. Usually the family will take them. We have van services that will take them to the doctors, but we also have everybody that comes to us. I have a medical director at my place. Anybody, when you're at my homes, a lot of times you'll have people that can't leave. It's too hard for them to leave to go out to the doctor. It's a lot of work for them to go.
Okay.
So all of our services, you can bring everything to our facility. So doctors, physicians, physical therapists, hairstylists, beauticians. I mean, everything. We have all the services you can imagine that will come to the facility.
And another important point probably be who are the one that make this type of authorization, right? So family members should probably have the power of attorney.
100%. Yeah, they should.
Because most of your patient might not be able to even communicate, directly.
And I always tell people to start that process early because power of attorney is not always a quick process. And sometimes, most time, people need to be a quick process.
Right.
And it's not a quick process.
Right.
Yeah.
And the power of attorney, I always tell my client too, you get it way before you get sick.
You do.
Because, a lot of time as an attorney, I can't have somebody sign if they don't have the ability to
That's what's
sign
hard.
anymore.
Yeah. Especially financial too.
Right. So then that way, they would have to go to court to get like a conservatorship. Do you have people that do that
All the time.
too? Yeah,
All the
that's more difficult, right? Because every time that you want to change something, you have to go back to court again.
Correct. And it's hard when you have memory impairment like that. It's very hard to get that person to sign and actually have the attorneys get the whole paperwork done. I totally agree with you. You get it done before. And most time family members have their son or daughter take care of it. So the trust is like irrelevant at that point.
Right.
So I always say get it done early so when the time comes up, it's already completed and it's an easy transition to move mom or dad out to where they have to go to.
Do you normally take the statutory form, the healthcare directive? Do you take that also?
I take everything. So when people move in, I ask them for a copy of everything. So if anybody comes over and needs a copy, I have it. I know who to give it to and not to give it to, of course. But yes, it's much easier when I have copies of everything.
Great. Yeah, that's also one thing that, I always tell my client, you want to have this piece of document available and do it now when you still have the ability to do so.
Yep.
Okay. One other thing that I want to know is if you can tell me a little bit about how about the cost? How much does it usually run? Yeah,
so it really fluctuates in the industry a lot. So normally like the larger assisted living facilities, the big ones, they might have like an admission fee. And then they usually have like their room rent fee. Like if you have a small little apartment, say, you have the apartment fee or the room rent fee. Then from there, they kind of do their evaluation and they find out what level of care you need at that point. Then usually there's like 3 or 4 different levels of care. And you might start off at level 1 and then eventually you're going to go to level 2, level 3, and level 4 and so forth. So the pricing model, I could say with all honesty, is kind of like, it's very discouraging to be honest, especially with the large ones. I know a lot of my friends that have the large ones are going to hear this and not be happy with it, but everybody that comes to my facilities usually leaves a large facility because their price doubled in 1 month. It went up $3,000 or $4,000 in 1 month because mom might have been diagnosed with dementia, and they can't afford now $8,000 or $9,000 a month anymore.
Well, that's quite true because average cost in California can, from the number the government put out, it's like $7,000 or $8,000
Correct,
a month
yeah.
for a nursing home. So that's really get into a lot of your asset, and you have spend out quite a bit. So we're gonna come back and talk a little bit about how we can use some insurance to help with this.
Great.